Hello, this is Silver Queens. Today, we're going to talk about a topic that you must know. For the healthy lives of middle-aged individuals. Precisely about diabetes symptoms and prevention and management methods. Diabetes is a chronic disease that can cause various problems in our entire body. Beyond simply a state of high blood sugar, and especially after middle age. The risk of developing diabetes increases, so you should be more careful. Diabetes refers to a state where the glucose in the blood, that is, blood sugar, is higher than normal. Our body uses the glucose obtained through ingested food as an energy source. And at this time, a hormone called insulin plays an important role. Insulin is secreted from the pancreas and helps to move glucose in the blood into cells to create energy. However, in the case of diabetic patients, insulin is not sufficiently secreted from the pancreas. Or even if it is secreted, it does not function properly, so blood sugar is not properly controlled. The elevated blood sugar like this damages blood vessels and can cause various complications. The characteristic symptoms of diabetes include polyuria, polydipsia, and polyphagia. As blood sugar rises, sugar is excreted through urine, taking a large amount of water along, so you urinate frequently, and the body feels a lack of moisture, causing thirst and making you drink a lot of water. Also, food is not used as an energy source and is excreted. So you feel fatigue and lose weight, and you often feel hungry and look for food. In addition to this, symptoms such as blurred vision, itchy skin, tingling in the arms and legs, or wounds that do not heal easily may occur. However, if blood sugar is not severely high, there may be no symptoms at all. If diabetes worsens or is left unattended for a long period, blood vessels narrow and blood cannot flow sufficiently to specific parts of the body. So various complications can occur, and in severe cases, it can lead to death. Major complications are as follows. Diabetes can cause cardiovascular diseases that increase the risk of heart disease, stroke, and peripheral artery disease. High blood sugar damages blood vessels, causing arteriosclerosis, which can lead to heart attacks or strokes. It can also cause kidney disease that damages the filtering function of the kidneys, leading to kidney failure. In severe cases, dialysis or kidney transplantation may be required. High blood sugar causes nerve damage, leading to diabetic neuropathy, which causes nerve damage. This causes tingling, pain, and numbness in the hands and feet, and in severe cases, can lead to foot ulcers or amputation. Diabetes can cause eye damage that damages the blood vessels and lens of the eye, leading to diseases such as cataracts, glaucoma, and diabetic retinopathy. Diabetic retinopathy is one of the leading causes of adult blindness. Due to nerve damage and impaired blood circulation, the feet are prone to ulcers and infections, and in severe cases, foot problems can occur that may require amputation of toes, feet, or legs. Diabetes can cause cognitive impairment and dementia that damages blood vessels and nerve cells in the brain, increasing the risk of cognitive decline and vascular dementia. People with diabetes have weakened immune function and are susceptible to infections, which can increase the risk of infection, leading to hospitalization and death. According to some studies, diabetes can cause cancer that may increase the risk of certain cancers, especially gastrointestinal and female-specific cancers. So, why does the risk of developing diabetes increase after middle age? Several factors work together, but one of the biggest causes is aging. As we age, bodily functions decline, and the function of the pancreas, which produces insulin, also decreases. Also, reduced physical activity and irregular eating habits increase weight, which is also a factor that increases the risk of developing diabetes. In addition, the stresses and irregular lifestyles of modern society are further increasing the risk of developing diabetes. Frequent overtime work and company dinners, instant food consumption, and lack of sleep have a negative impact on blood sugar control and can increase insulin resistance. Insulin resistance refers to the phenomenon in which cells do not respond properly to insulin, even when insulin is normally secreted, causing blood sugar to rise. In order to prevent and manage diabetes, it is most important to maintain healthy lifestyle habits. From now on, shall we find out some practical tips for diabetes? Prevention and management with Silver Queens? The first is healthy eating habits. It is important to maintain stable blood sugar levels through a balanced diet. It is good to reduce carbohydrate intake and consume foods rich in fiber. It is best to avoid processed foods or foods high in sugar. According to Comedy.com, it is good to eat foods that are low in calories and saturated fat. And it is good to consume plenty of vegetables, fresh fruits, whole wheat foods, dairy products, and omega-3 fats. For blood sugar management, it is good to consume fiber-rich multigrain rice through your diet. If you mix brown rice, barley, beans, etc. instead of white rice, it helps blood sugar to rise slowly. Also, it is important to consume enough vegetables of various colors every meal. In particular, broccoli, spinach, and cabbage are rich in nutrients that help control blood sugar. Consuming protein with lean meat, fish, tofu, and beans increases satiety, prevents overeating, and helps maintain stable blood sugar levels. It is also important to consume unsaturated fatty acids such as nuts, avocados, and olive oil for healthy fat intake. Unsaturated fatty acids help improve blood cholesterol levels and lower insulin resistance. Fruits are rich in vitamins and minerals, but it is important to consume them in moderation as they have a high sugar content. In particular, apples, pears, and strawberries belong to fruits with a low glycemic index. The second is regular exercise. Steady daily physical activity is very helpful in controlling blood sugar. Combining aerobic exercise and strength training is also effective for weight management and can improve insulin sensitivity, improving blood sugar control. Dr. Rita Kalyani of Johns Hopkins University School of Medicine said that exercising for 30 minutes every day and losing 7% of your weight can reduce the risk of type 2 diabetes by 58%. Steady daily physical activity helps manage weight and improves insulin sensitivity, improving blood sugar control. Walking exercise can be started easily regardless of location or time. It is recommended to aim to walk for at least 30 minutes every day. Using the stairs instead of the elevator strengthens lower body strength and is effective in increasing calorie consumption. Strength training using dumbbells, bands, or your own weight increases muscle mass and increases basal metabolism, which helps control blood sugar. Exercising with friends or family is motivating and helps you continue exercising steadily. Making exercise enjoyable helps relieve stress and allows you to continue exercising steadily. It is important to choose an exercise that you enjoy and do it steadily. The third is regular blood sugar monitoring. It is important to regularly check your blood sugar levels to understand your condition and, if necessary, seek advice from medical experts to adjust your treatment plan. In particular, if you are over 45 years old, it is recommended to check for diabetes through regular health checkups. According to MetLife, people over the age of 30 have low awareness and treatment rates for diabetes. So more active interest is needed. In addition to this, managing stress and getting enough sleep also helps prevent and manage diabetes. This is because stress can increase blood sugar levels, and lack of sleep can worsen insulin resistance. Find your own stress relief methods such as meditation, yoga, or listening to music, and it is good to get 7 to 8 hours of sleep every day. Also, quitting smoking and reducing alcohol consumption are essential things to keep in mind for preventing diabetes. Smokers have a 30 to 40% higher risk of developing diabetes than non-smokers. And excessive drinking can interfere with blood sugar control and harm liver health. In the United States, the DPP Diabetes Prevention Program, sponsored by the NIDDK National Institute of Diabetes and Digestive and Kidney Diseases, has proven how effective lifestyle improvements are in preventing diabetes. According to the DPP study results, participants in the Lifestyle Improvement Program had a 58% lower risk of developing type 2 diabetes compared to people who took a placebo, and especially participants over 60 years of age had a 71% lower risk. This study emphasizes the importance of lifestyle improvement in diabetes prevention and has contributed to spreading diabetes prevention programs worldwide. Preventing and managing diabetes goes beyond simply lowering blood sugar levels. It is a process of improving the quality of life. Healthy eating habits and regular exercise not only help manage weight, but also help prevent other chronic diseases, such as cardiovascular disease, stroke, and cancer. Also, stress management and getting enough sleep promote mental health and increase life satisfaction. Through diabetes prevention and management, we can cultivate a healthy body and mind and live a richer life. Diabetes is a disease that can be sufficiently prevented and managed through continuous management and effort. Please remember the tips Silver Queens told you today, and I hope you create a vibrant middle age and a happy old age through healthy lifestyle habits. This has been Silver Queens.